Having a new baby is an exciting life stage for many families. However, for many women, this time may be affected by unexpected physical, psychological, and emotional changes, known as perinatal depression. Perinatal depression is one of the most common medical conditions experienced by women surrounding the time of their baby's birth. It is estimated that the number affected ranges from 1 to 2 women out of every 10. Perinatal depression is not the same thing as baby blues, which are normal intermittent mood swings experienced in the first 1 to 2 weeks following birth. Perinatal depression is more severe than the baby blues because it involves experiencing major depression signs and symptoms anytime during pregnancy through 12 months after delivery. Signs and symptoms of perinatal depression may include changes in sleep patterns, changes in appetite, ongoing exhaustion, frequently feeling anxious, sad, irritable, or overwhelmed, being unable to enjoy activities and situations that were enjoyable in the past, having difficulty completing normal daily tasks, feeling hopeless or helpless, having a disinterest in being around or connecting with others or the baby, decreased interest in sexual activity, frequent or disruptive fear that harm will come to her baby, and less commonly, experiencing thoughts of harming oneself or others. Because many of these symptoms often accompany pregnancy and the immediate postpartum period, perinatal depression often goes unnoticed and untreated. Some women are more likely than others to develop perinatal depression. Risk factors for perinatal depression during pregnancy include having a personal or family history of depression or anxiety, current or previous experience with one or more major life stressors, not having enough support from friends and family members, or being in an unhealthy or abusive relationship, having an unintended pregnancy. Additionally, a woman is more likely to develop perinatal depression after the baby is born, also known as postpartum depression, if she had a difficult or traumatic pregnancy or childbirth, experienced depression or anxiety during pregnancy, gave birth prematurely, or her baby had to spend time in the neonatal intensive care unit, or NICU, and if she experienced problems with breastfeeding. Understanding the signs, symptoms, and risk factors of perinatal depression is an important part of recognizing the condition. While there are many effective treatment options for perinatal depression, treatment cannot begin until the condition is identified. It should be the responsibility of all people involved to be on the lookout for signs of perinatal depression.
I'm really worried about you. Can we call Dr. Kate?
This includes friends, family members, partners, pregnant and postpartum women, and their healthcare providers. If you feel that you or someone you know may be experiencing perinatal depression, speak up. To keep both mom and baby safe, do not wait to see if these signs will go away on their own. A woman with signs or symptoms of perinatal depression should see a healthcare provider or mental health professional right away. Depending on a woman's individual condition and needs, a healthcare provider may recommend one or a combination of the following treatment options: medications, individual or group counseling by a mental health professional, support groups, brain stimulation therapies, light therapy, frequent exercise and dietary changes. Your healthcare provider may also recommend alternative therapies such as acupuncture, meditation, and faith-based support. Women and families should talk with their healthcare provider about which treatment options are best for them. While perinatal depression can feel devastating to a woman and her family, it is a very treatable condition. Looking out for this condition and getting help right away are essential to the well-being of women, babies, and their families.